This video tutorial gives an introduction to the LEADER Guidance Pack for estimating the social costs of illegal drug use, developed as part of the EC-funded project LEADER, which stands for Looking at Economic Analyses of Drugs and Economic Recession. In this tutorial, you will learn about how we define social costs of illegal drug use in LEADER and why their estimation is important for public health, how the LEADER Guidance Pack was developed, who it is for, and how we recommend using it. The term social costs of illegal drug use refers to a way to quantify the various negative consequences that illegal drug use has for society as a whole. The most important costs are premature mortality and its consequences, additional costs of healthcare services, additional costs relating to the criminal justice system, additional costs in terms of social benefits, costs of prevention initiatives, and costs involved in education and research on drug use. Because people who use illegal drugs often die earlier than non-users, the society loses these people prematurely, and this loss can be expressed as the number of years of their lives lost. We can assume that if those who die early live longer and in good health, they could continue to work and support families and generally contribute to the benefit of the society. Therefore, the number of working years lost of prematurely deceased drug users' lives is the basis for the estimation of productivity potentially lost by the society. As well as the kinds of social costs already mentioned, illegal drug use can cause human harm, pain, and suffering, as well as mitigate some forms of pain and suffering. These costs and benefits are only partly measurable, but should still be described and discussed in any attempt to estimate social costs. Because illegal drug use has been identified as the cause of many negative consequences for users and for society as a whole, policymakers and other stakeholders need to apply a variety of measures aimed at preventing or attenuating the negative effects of illegal drug use. However, the resources allocated for this are limited, and therefore decision makers need to establish priorities for their use. Decision makers are also interested in the cost-effective allocations of funds, and their decisions should use the knowledge on the magnitude of the consequences of illegal drug use for different subjects as a basis. Accurate and detailed estimates of the social costs of illegal drugs are needed to be able to estimate the burden of illegal drug use, to set priorities for prevention initiatives and treatment services, and evaluate the effectiveness of population-level interventions, regulation, and public health policy. It is also important to document the health and well-being footprint of illegal drug use as an accountability, monitoring, and advocacy tool. Although there are several existing guidance documents for estimating the social costs of drug use, there are many inconsistencies and lack of consent on how to solve methodological and practical problems. Systematic reviews of scientific literature on cost estimations and of existing guidance documents carried out in the LEADER project concur that the social costs of illegal drug use are high. However, they have found a great deal of methodological heterogeneity in the field. This is mainly due to the complex nature of drug use phenomena and human behavior, and the variety of regulation systems and different philosophical viewpoints that exist regarding drug use. As well as this heterogeneity, which makes comparisons difficult, we detected several shortcomings in existing guidance. Existing guidance documents rarely indicate how to measure the costs caused by drug users, which are incurred by people other than the users, known as harm to others. or how to estimate the proportion of the social costs of illegal drug use that could potentially be avoided, known as avoidable costs. Also, there are gaps in data, and those doing estimates need advice on how to fill these gaps. In Europe, different methodologies and ways of presenting cost estimate data mean that it is difficult to compare across countries. For these reasons, the Leader Guidance Pack is intended to explain a standard and internally coherent methodology for estimating various costs of illegal drug use, as well as to propose a standard way of presenting these results for basic social cost components. The first outline of the structure and contents of the Guidance Pack, developed by Zofia Mielecka-Kubien at the University of Economics in Katowice in Poland, was informed by 2 systematic reviews undertaken in the first months of the LEADER project. A systematic review of existing publications on social costs of illegal drugs and alcohol and tobacco, led by the research team at the Clinic Foundation for Biomedical Research in Catalonia, Spain. This review identified 42 studies which met the inclusion criteria: 8 for illegal drugs, 26 for alcohol, and 8 for tobacco. There was a high variability for non-treatment of cost components included, and total costs, while clearly significant burdens on society, showed great variability between studies for all 3 substances. For instance, price per capita for the year 2014 ranged from €0.38 to €78 for illegal drugs. A review of existing guidance documents in estimating the social costs of drugs, led by a research team at the Agency for Health Quality and Evaluation of the Catalan government in Spain. This review identified 63 guidance documents, 27 for estimating costs of illegal drugs and 36 for alcohol and tobacco. The review highlights the absence of comprehensive and complete approach in the field. No approach can be considered as optimal or without limitations. In conclusion, 2 frameworks for cost estimation are put forward: a minimum standard which researchers should refer to for conducting social costs of drug estimation studies, aimed at ensuring a basic level of reliability, and an optimum framework representing a more ideal and work-intensive approach for estimating the social costs of drugs. The Guidance Pack outline was shaped and revised by comments from both the LEADER partners and external experts who were invited to contribute through a web-based consultation and email exchange, which was followed by an in-depth face-to-face review meeting in April 2016. Following this, a pilot test of the Guidance Pack was undertaken in order to explore the accessibility and usability of the Guidance Pack and the feasibility of using it to undertake a social cost study, after which a final revision of the 2 components resulted in the final version of the LEADER Guidance Pack. In developing the LEADER Guidance Pack, emphasis was put on the practical side of the estimation. For any given method described, corresponding assumptions and shortcomings are discussed to give a full understanding. Most of the methods presented could be applied within different theoretical frameworks. Practical examples are provided using the estimation results obtained from Alice Rapp, an EU co-funded project on addictions and lifestyles in contemporary Europe, Reframing Addictions Project. One study in the Alice Rapp project focused on social costs of addictive substances and behaviours, and calculated social costs of illegal drugs for Poland, Portugal, and Catalonia, the autonomous region of Spain, as case examples. The LEADER Guidance Pack is aimed at research professionals who intend to estimate the social costs of illegal drug use in a given jurisdiction. Making these calculations requires some multidisciplinary knowledge. Knowledge of economics is necessary to determine what data should be used and where to look for them in a country. To estimate premature mortality in years of life lost, some knowledge of vital statistics and epidemiology are needed. You'll also need to be able to read, understand, and calculate according to mathematical formulae. Finally, this exercise takes some time and collaboration. Based on the experience of those who kindly piloted parts of the guidance pack, it's estimated that the full process could take between 3 to 6 months, requiring some collaboration across public administration departments and institutions such as national statistics offices, the Ministry of Justice, or the National Health System in the collection and provision of data. The Leader Guidance Pack consists of 2 complementary tools, both of which are publicly available on the Leader Project website, and there's a link in the text box below. The Guidance PDF document, which introduces the reader to the topic and then presents a suggested methodology for estimating each of the social costs of illegal drug use, explaining and commenting on the approach and then including practical examples illustrating each step of the estimation with the help of the Excel screenshots. The Excel file, containing examples of social cost estimations using real data, including empty Excel templates where own data can be introduced as to replicate the examples, obtaining results thanks to the automatic calculations included in each of the spreadsheets. We recommend having both documents at hand, as it can be useful to skip back and forth from one to the other when looking into each of the chapters of this document. The Leader Guidance document is divided into 4 core parts. Part 1, about the Leader Guidance, contains introductory remarks, a theoretical overview of some of the possible approaches to estimating social costs of drug use, and outlines the assumptions adopted in the given practical examples. Part 2 is the main practical part of the document, where cost estimation guidance is given for different kinds of social costs, which will be explained shortly. Each chapter of Part 2 follows a standard structure, where the theoretical background to each method is first presented, along with any special considerations or limitations. The theoretical considerations are followed by a summary box, which gives the practical requirements for the calculation. And finally, illustrative examples with full instructions provided throughout the document on how to undertake the estimations and present the results with the use of the computer program Excel. Part 3, titled Using Cost Estimates, suggests a standard way of presenting the whole estimation results, with the intention of facilitating comparability of cost estimate results between different countries. Part 4 of the document provides supporting information in the 3 appendices. The first gives considerations of the sampling theory used. The second, basics of using a regression function in Excel and the interpretation of the results. The third gives guidance on graph construction in Excel. In Part 2 of the document, cost estimation guidance is given for different kinds of social costs, which have been grouped into 3 types. First, basic methods used to estimate the social costs accrued by those using drugs are explained, including premature mortality related to illegal drug use and the direct and indirect consequences. Direct consequences include the number of lives lost due to illegal drug use, the number of years of life lost, the reduction in life expectancy, and loss of life potential. The calculation of loss of life expectancy at birth, or E0, and life potential of illegal drug users are described in more detail in the second video tutorial on the Leader Guidance Pack. Indirect costs refer to lost productivity mainly due to premature deaths or the disability of drug users. Next, the social costs of morbidity due to illegal drug use is calculated, including consequences for healthcare services such as inpatient costs, outpatient costs, emergency costs, and pharmaceutical costs. Social costs due to lost productivity related to drug use morbidity are explained, as well as criminal justice and law enforcement costs. Possible ways of filling gaps in statistical data are suggested for these criminal justice and legal costs, where data is often incomplete. The second type of social costs addressed in the leader guidance are those accrued by people other than drug users, such as family or friends or victims of drug-related crime. Harms to others can be seen as an extension of standard social costs, although often traditionally treated as a separate cost category. Thirdly, avoidable costs are explained. These are the costs that can be potentially and realistically avoided through appropriate social policy initiatives and behavioural changes in the population. They can be estimated based on the total costs of the other two types already mentioned, and can be used as a powerful advocacy tool and a stimulus to action to reduce social costs of illegal drug use. The two standard methods to calculate avoidable costs, known as the feasible minimum and Arcadian normal, respectively, are explained and illustrated. Unlike many other guidance documents, the Leader Guidance Pack includes instructions to calculate avoidable costs according to Helvig's method, which is a technique allowing a statistician to compare social costs in different countries, taking into account multiple features of the different countries in relation to drug use. Further details of the Leader Guidance are given in the next video tutorial, describing the contents of the Leader Guidance Pack, for which a link is provided below. The Leader Guidance Pack tool, as well as other Leader outputs, are publicly available for download from the Leader Project website.